permit me at this point now to introduce Mr. Idris Zahidi. He's from Egypt. He was with us last week and gave us the first set of lectures. He's a biomedical engineer who specialized in medical imaging. He also has a PhD in public health management and also has done a lot of work in advanced clinical applications. He's one of the leaders for such in women health ultrasound in Africa from the GA Healthcare. And he's also a specialist in clinical applications, especially in imaging. He has over 8 years experience of working with GA Healthcare. He has always been a friend of our program and our workshops. As you all know, we try to make sure we get people from different parts of the world to assist in making sure that we achieve our aim of passing down information and knowledge. So please permit me now to invite Mr. Idris, PhD, to give us his presentation on optimization of your ultrasound for Dopplers. Just for information, next week we're going to be talking on the clinical applications of Dopplers. For those who have been involved in women's health, and these days there are a lot of Doppler results that are coming out, and sometimes some of them might be suspicious. So it's based on that we're taking that as a very important topic so that people can understand the basis for Doppler imaging and how to interpret the results. Mr. Zaidi, I know you are around, so please can you speak to us? Great, welcome.
Thank you, Doctor. Thank you for this introduction. So indeed, last week we have started a first series of the webinar, and we talked about the 2D image optimization. And today I will be happy and really honored to be part of this webinar to allow me to share a little bit of my knowledge and my experience in terms of ultrasound imaging, especially in this tough face-to-face, but now we are using like the tool like webinar in order to connect and share and continue delivering clinical education in this little bit hard situation. So now allow me please to share my screen. Doctor, can you give me the ability to share the screen, please?
Yes, you can. Just...
The host disabled participant screen sharing. Can you enable it?
I have enabled it. This should not stop today. Okay. Go on.
No, still disabled.
What's going on? Sorry, just a minute.
And he can share his screen.
Yes, but that won't be able to. That will take me a little time. Okay, let me try and do something else now. Okay, yeah, okay. All right, fine. You can.
Share screen now. Still have the screen sharing.
Dr. Ehiga, you can make him a co-host,
yes,
and then he can share his screen.
That's what I'm trying to do now. This hasn't happened before, so. You working?
No.
Why today?
Co-host, and he can share his screen.
Okay, so Idris, you can see the screen now, right?
Yes.
Good. So you can just speak to it so that you don't waste too much time.
Okay, so last time we saw about how to optimize the 2D image quality. And when we talk about 2D image quality, it's mainly the most important thing that we need to keep in mind from last session, just as a quick reminder, is that there is a specific process to follow when you are optimizing your image quality. It means that first of all, you start with your depth according to the patient and the fetus position. The second thing is then your focus. You ask yourself, what is the region that I'm looking at in my exam, and then you have to adjust your focus at this position. Then the frequency, here you will have this compromise between penetration and resolution. And the fourth thing is the gain. So if you follow clearly these 4 steps, depth, focus, frequency, and gain, you will really have a good image quality, and you will be sure that you have done what is necessary to in order to improve your image quality. And don't forget, please, that always a good 2D image quality will have a good impact on the color Doppler imaging and on the 3D and 4D acquisition. That's why it's really, really important to really have a good image resolution on a good image resolution on 2D, and that's why it's good to always optimize the image. So then I said that it will have an impact on the color Doppler imaging. And you know that today we are using more and more color Doppler when it comes to color flow or even power Doppler. We have now on all the machines high definition Doppler, like the HD flow that we have on the Voluson machine. Then we do some pulsed wave imaging, and we have a lot of new advanced color Doppler. But here really today the goal is really to see how we can optimize the color Doppler and the pulsed wave Doppler, how to have the color in sync. So if we can move to the next slide, please.
Yeah. Okay. No, it's a PDF document, so that's where the problem is.
Vega, can we move to the next slide? Thank you. So here, what is the most important thing when you are doing color Doppler imaging is the incidence of the probe. It's very, very important because when we are doing, we have a lot of we can use in order to optimize our 2D image. We can use the frequency, size, the PRF, the baseline, but really the most important is how you are orienting, or how you use the probe, and how is the incidence of the probe compared to the location of the vascular structure. Why? Because simply we are using a formula that is using the cosinus in Doppler. We have using some algorithms that are using cosinus in the formula, and then if you are orthogonal to the vascular structure, you will have the formula that is calculating the signal will use the cosinus 90 because we are orthogonal, and we will have 0 because cosinus 19 is 0. So here we will have, in this situation, if the probe is orthogonal to the vascular structure, we will have no signal. We will have no feeling on the vascular structure. If we are not orthogonal, like in the second here, in the second image, here we will have a signal because our cosinus will be lower than 19. So 90. So we will not have a signal because here we are not orthogonal to the vascular structure. So sometimes when you don't have, when you don't see any feeling or any color Doppler signal on the vascular areas or on the heart, for example, just try to change the incidence of your probe, and you will see that you will improve your vascular structure and the feeling of the color Doppler. So really very, very, very important. Of course, before doing that, before activating the color Doppler, there is some optimization to do, especially on the B mode. The first thing to do is to reduce the sector whites to include the anatomy of interest. If I'm looking at the heart, I will reduce my angle of exploration, the width of the sector in order to include only the heart. Why? Because it will improve my frame rate. The second thing to do is to reduce the depth and reduce the gain, because when I will reduce the gain, I will help my color Doppler to detect the flow, because I will improve my grayscale on the image. Very important. Always. So the sector or the angle of exploration, the depth and the gain. These three things will help you before activating the 2D, the color Doppler. It will help you to really to improve the image quality of the color Doppler. Then you will activate your color Doppler, whatever the machine you are using, either it's a GE machine or another machine, or the machine that we have today on the market, you can follow these steps. So the first one was to optimize the 2B beam mode. And the second one is to activate your color Doppler and decrease the region of interest box size to only include anatomy of interest. You are on the brain, you want to get the Willis polygon, for example, you have to reduce this box to include only that. You are on the heart, on the 4-chamber view, and you want just to check the permeability of the septum, include only the 4th chamber on your box. Why? Because it will increase the sensitivity of your color Doppler. If you take a large box, you will really lose in terms of sensitivity of the color Doppler. And the tips here as a clinical application specialist, what I can give you as a tips for the region of interest box is that the width of this box has more effect on the sensitivity than the height. So always try to reduce it in the width, not on the height, because it has more impact. So now we optimized the 2D image quality. We clicked on color Doppler, and we have our box, and we are starting to see the feeling of the arteries. Here, with what is the most important is to understand the PRF, the pulse repetition frequency. You know, the PRF is like the frequency for the color Doppler. It's what it allows us to really optimize your color Doppler sensitivity. Why? Because the PRF is really the frame that you are using in order to detect the flow. And so what you have to do, it's really always my advice here, to decrease the PRF until you see the aliasing appearing, really, and then you increase until you just get rid of the aliasing. Okay, so we decrease the PRF as lower as possible. Here you will start to see a lot of aliasing, and then you start to increase step by step. And when you see that you get rid of the aliasing, here you will have a very good color Doppler sensitivity and a very good color Doppler optimization. Of course, if you have a very tough patient, a very hard to scan patient, you can play on the frequency. Then what you can use, so you have the feeling now, what you can use is the gain. You know, this global signal amplification that is present usually on the bottom of the color Doppler. On the 2D button, you have the gain of 2D, and on the color Doppler, you have the gain of the color Doppler. If you increase it a lot, try to play with that. Increase it a lot, you will see that you have bleeding outside the vessel. And if you reduce it, you reduce the gain, then you will get color. You start to reduce it till you just feels the vessel. Okay, so always increase it to see how it's bleeding outside, and then gradually you start to decrease the gain until you have just a good feeling of good feeling of the arteries. Then what is important also, and as you can see in this slide, is that you see that according to where I am on the artery, I have different velocities. We don't have the same speed of the flow if I am close to the border of the arteries or I am at the middle of the artery. You see, I don't have the same speed. So that's why the tips here is always that the sample size should never exceed the vessel diameter. Of course, this is very important, which is normal. I'm sure we're all doing that. And then the second thing is that always we should place the gate at the center of the vessel. Why? Because as you can see on this graph, it's at the center where we have the highest speed. So that's why we should focus on the center of the vessel to place our sample the to place our sample for the pulsed wave Doppler. And use or optimize once we have put our sample at the middle of the vessel. You will see that we will have, if you want to detect a good or the low flow and have a good sensitivity of your spectre of the pulsed wave Doppler, we should always use a low PRF to detect slow flow. So even when you are on the pulsed wave Doppler, once you launch your pulsed wave Doppler, just reduce your pulsed wave Doppler, you will improve the sensitivity of your color Doppler. You see, very simple, but straightforward. And this is how you will optimize and improve the sensitivity of your color Doppler. The 2D image quality first, then the size of the region of interest, then the gain, of course, because it will overfill or it will have bleeding outside if you increase it. Then the PRF, decrease it until you get aliasing, and then the alias your pulsed wave Doppler. Always your sample at the medium of at the center of the artery, and then decrease a little bit your PRF to get a good to detect or the slow flow. So this was our quick intervention today about color Doppler imaging. I'm sure we will be sharing with you the slides so you can review them. Thank you very much, and it was really a big pleasure to share with you these tips and tricks for color Doppler optimization.
Thank you very much, Idris. It's really a great pleasure to always have you helping us out on some of these very difficult areas. I do appreciate the fact that for those who have not been practicing Dopplers, a lot of what he was saying will sound like Greek to us. But for those who have been in Dopplers, you would have picked certain things. I have been in Dopplers for a while now, but I still picked a lot, especially on what you do with the PRF and how you adjust gain for you to know, yes, once it's getting beyond the vessel, then you now start moving in the opposite direction. Usually, I don't cram whether you increase or decrease. You scroll to one side, you find that it's going beyond what you expect, then you scroll to the other side. So all these are things that we'll pick up and learn along the way, and we all will continue to get better. I really can't see much questions on this now, but this is actually a teaser because by next week, we'll be having one of our big gurus from the United Arab Emirates, Dr. Thompson, who will be talking to us on the clinical aspects. I too will be speaking next week on the clinical aspects of Dopplers. We'll be sharing some images, and we'll be sharing some of the reports that we've seen in our country, which we want to guard against. And we'll share with people and say, these are not the things that we want to encourage. So essentially, we expect that every person will try to make sure that they join us for the next week's event. I want to share a little bit of what we intend to discuss by the next week's program. So one of the things that I need to just mention here is that the recording, you may feel free to visit our website, which I'm scrolling right now. If you visit the website, www.beneath-diagnostics.org, we'll be putting in details of the upcoming webinars and how you will join. So we found that a few individuals had challenges with joining today, but we all must move with the times. So it's obvious that some of us have not yet gotten used to how to use the Zoom platform. There are a few other new platforms that are coming up, but Zoom seems to be the commonest. So we expect that every person, at least by being forced to join this webinar, a lot of persons are learning. So we keep learning the job. I too keep learning. So there have been a few errors today, and we expect that we will improve with them. Network is also a challenge depending on where you are, but we are sure that all these things will keep getting better. Our contact info is also here as well. But in case you can't remember all this, just remember the website. And once you get to the website, there are a lot of package. For those who are still wondering what Dopplers are, people still think that you need to send Nigerian women out to Egypt or to South Africa to do Dopplers. That's no longer true. So those are some of the things that we'll be discussing next week. And we'll have some experts who will be discussing them. They do not have any other place of getting it. They'll be able to visit our website and be able to find out some of these details that we are putting forward. So, as we've always said, we try to keep to time, and we are glad today that we started 3 on the dot, and it's 4 minutes past 4 now. We have planned this program for 1 hour, 15 minutes. So, we have essentially done that. We spent 1 hour, 5 minutes. As a recap, at the beginning, we had a panel discussion that talked about resolving our financial issues. There were some take-home messages. One of them is the issue of planning and budgeting. And we're very glad that Dr. Okoye from Abuja and Everest Okpara, the CEO of Everite Diagnostics in Owerri, and Dr. Constance Shehu from Sokoto were able to join us and share their experiences, and we were able to learn a great deal from them. We were able to learn that they did a lot of things for their staff. They tried to make sure that the staff took sheets to reduce their exposure. One of the things we also learned a lot was the issue of scheduling. I thought Nigerian patients will not adhere to scheduling, but we heard Dr. Okoye tell us specifically that he does that for his patients. And if you come when you are not scheduled to come, then that could be a challenge for you. So based on that, we learned a good deal from them. And then we also learned from Mr. Everest, who is the chairman of the Owerri Chambers of Commerce, Industry, Mines, and Agriculture. So a lot of take-home messages from them. And also from Idris, from Egypt, we've been able to learn a lot too about optimizing our images for Dopplers. He talked about the region of interest, using the box effectively, and then he talked about using the gain, and then adjusting the PRF. Unfortunately, these things are best done as hands-on sessions. But I must also inform you that working with ISOG, and especially with the outreach program, they're already trying to look at ways in which you can teach ultrasound without being physically present. It's a bit tasking, but there's a lot going on in the ultrasound world now, how you can achieve these things. And I'm sure that very soon there will be breakthroughs. Already, there are simulators for teaching ultrasound, and I'm sure some of these things will also be built into these type of programs whereby you no longer have a face-to-face meeting, but you can still teach many others. I want to say a big thank you to all who have participated, our panelists, our discussants, and every person who has sent in questions. Also to tell us too that we should not feel so despondent. We keep praying that God blesses all of us and makes us continuously well. So as a parting shot, I want to say a big thank you to all those who have participated in today's program. Thank you to all our facilitators of the Bini Ultrasound workshop, and I see many of them around. I've seen Laide. I've also seen Tonia from Iroa, and many others too. I've seen Solomon Ibaruma from Benin, and many others who are around. We say a big thank you to all of us. I want to thank specifically also Ibrahim and Shile from Jos, who have been there planning these programs, designing the programs, making inputs into the various topics that we have. I already announced the topic for next week. The week after that, we're going to have transvaginal ultrasound scan, and we've already contacted two of the big names in transvaginal scan in the country, one coming from Delta State and the other one coming as far north as Maiduguri, and I'm sure that we're all making plans to attend. Thank you all very much for having attended, and may God continue to keep us safe. May God bless us all. So as I check the chat now, I don't think there are really questions. Thanks so much for the presentations. Some people are not hearing. We apologize for that, but just like all learning, so we keep learning and seeing how it's just part of it actually has to do with the network where many people are. And we do hope that once you are joining these programs, you can try to go under the tree where the network is better so that you don't miss out. In the absence of any other very important information, I want to say, finally, thank you and God bless us. We'll meet again, same time, same station, next week, 3 p.m. Bye to all of us. You can show by going to reactions and saying clapping or giving us a thumbs up. Yes, hands are being raised, so we'll say a big thank you to all of us. So the site will remain open while I share some of the slides for next week's program, part of what I already have shown just now. So we are officially closed for today, but you can just copy the website address as I project it. Thank you, and God bless us all.
That's lady that buy water and drink just now. Yes.
And for those who are still on